Hey, hi everybody. Happy Monday. It's 12:30, and this is Dr. Kenneth Muich, Stetson Chiropractic and the Fibromyalgia Wellness Center with our live video. This is video number 41, as a matter of fact. We started the beginning of the year in January, and we try to cover as many subjects as we can, health-wise, but especially pertaining to fibromyalgia patients. But it's very, very interesting because a lot of the subjects that we cover actually relate and refer to other areas of the health that are directly involved with fibromyalgia. Keep in mind, fibromyalgia makes all other conditions worse, and so symptomatic wise. So that's really what we're covering here. We're covering a number of different things that relate not only directly to fibromyalgia, but indirectly to so many other conditions. So what we're talking about today is the sneaky fibromyalgia symptoms. And that's really what ties into what I introduced to you just a few moments ago, because there's a lot of symptoms that people get confused with because they relate to other conditions. So the most common things in fibromyalgia, are the fatigue, overall body pain, irritable bowel syndrome, insomnia or sleep problems, fibromyalgia fog, where people have difficult time concentrating. All those things are the most common, but there's so many other things that we actually deal with fibromyalgia that a lot of people don't even realize. So what we do, I don't know if you can see this correctly or not, but we give each patient when they come in this brochure, and inside here it actually talks about all the different more common symptoms that patients have, and these symptoms directly relate to other conditions. And so that's again what we're trying to deal with here, is explain to you all these other conditions. For example, they involve the central nervous system, musculoskeletal, the stomach, genital urinary, dermatological, and miscellaneous. The miscellaneous covers all the other aspects as far as health is concerned. For example, some sneaky things. Hair loss, better known as alopecia. Okay, a lot of people don't really tie in fibromyalgia with alopecia, and yet alopecia is very, very common with fibromyalgia patients. They'll come in and they'll look like they're partially bald, especially women. It is very, very disconcerting as far as that's concerned. They even say as they comb their hair, brush their hair, they look at their comb, and a lot of their hair is automatically gone. Well, how about joint pain? That's very, very common with fibromyalgia patients. Now, joint pain, you would not think, because if you look at osteoarthritis, rheumatoid arthritis, a lot of the itises, so to speak, the rheumatological conditions and osteoarthritis, they involve joint pain. But that's very, very common for fibromyalgia patients also. If you already have osteoarthritis or rheumatoid arthritis, it's going to make it worse. You're going to have those periods where you're going to have a lot more pain and so forth. How about brittle nails? Very, very common with fibromyalgia patients. A lot of people don't realize that. And that's very, very common again. Dizziness, headaches, vertigo, all those things are very, very common. Now, you have to understand that our research throughout UCLA has found that there's increases amounts of calcium and phosphate in the cells. And so the calcium phosphate combination burns out the mitochondria. We're going to talk about in just a few moments also. And that causes a lot of side effects. For example, excess calcium does not allow your brain, muscles, tendons, ligaments, all those things to relax. They're constantly at a state of tension. So when that happens, there's actually an increase in water in your body, and especially in your tissues, which then goes to swelling. And the swelling actually puts pressure on nerves, and that causes a lot of additional pain. And also other problems like paresthesia, numbness and tingling, and something called allodynia. Very, very common. It's actually a hypersensitivity to skin and tissue touching, and pain when there's no sensitivity, no reason to have pain whatsoever. So allodynia is very, very common with fibromyalgia patients, and that hypersensitivity is very, very common. I had a young lady come in, and I could barely even touch her because she was so sensitive, because she had this condition called allodynia, where even a light hug or pressure on the skin actually caused pain. And that is extremes as far as fibromyalgia is concerned. Isn't that a shame where people have to go through that they actually are suffering to that extent? Well, how about weight gain? Well, that's very, very common with fibromyalgia patients. Because they're sedentary, they're inactive. When they become inactive, believe it or not, the body actually destroys as much as 80% of the supply of mitochondria. Mitochondria are the things that allow you to have energy to do things, to shrug your shoulders, to talk, to think, to concentrate. And that includes all your organs and so forth that are so important. The evolution of just normal activities of daily living. But if you're not doing this, then the body says, well, if you don't need them, we're just going to destroy them. What happens then is that the body starts craving energy. And so what do? The body says, you're going to have to eat a lot of carbs. You're going to have to do this carb craving, so to speak. And so you're going to eat a lot of junk food and so forth to give yourself some energy. Problem with that is, isn't this interesting how it leads from one thing to another? What happens is that you have an increased amount of glucose that is released, and it releases insulin, and that then causes your body to convert this all of this excess into fat storage, not muscle, believe it or not. And so now you've got an additional weight gain just because of that. So by lack of activity, this all leads up to one thing leads to another. On the other hand, if you're already diabetic and have fibromyalgia, that actually causes another problem. It's called hypoglycemia, where your body actually craves, again, sweets and so forth that have to be taken care of, or carbohydrates that have to be taken care of. And so it's a over-exaggeration, so to speak, of insulin response that your body goes through that actually needs to be satiated by carbohydrates and a variety of other things. Now, this can be taken care of, and a lot of problems can be taken care of by reducing or going onto a low-carb diet. Now, not just a low-carb diet, but there's also glycemic indexes as far as food. And I mentioned this before. You have to really go on a low glycemic carbohydrate diet. I've been doing this for about the last 6 months now, and I've lost quite a bit of weight. And and I'm not doing anything else. I'm just watching the carbs that I eat. And it's very, very simple. You can actually go to Google and find out what low glycemic foods there are. Well, they're mainly the vegetables and so forth that you would think, staying off of certain things. My weakness was potatoes. I love potatoes, but that really causes a lot of problems as far as carbohydrates because they have a high index. The index has to do with, again, glucose and how much is in each one of those vegetables. And they all have some form of carbohydrate or glucose involved in it. But the bottom line is you want to keep that down, and then you'll really not only control diabetes, you'll control your hypoglycemia, and you also lose weight, believe it or not. Some other things for you to consider that fibromyalgia patients have that are sneaky, that people don't even consider or think of. How about abnormal tastes, okay, in the mouth? Metallic taste, something unusual and so forth. That's not uncommon as far as that's concerned. Of course, with the lacking of mitochondria production, you have increase in infections, a reduction in immune system, so your body's not able to function normally, and so it allows, obviously, all sorts of things to come into your body, and you're more susceptible to that itself. Because of the excess phosphate that is in your system, oftentimes you'll have burning tears, or you'll have a lot of sand when you wake up in the morning in your eyes, the Sandman theory, so to speak. And also it affects, I've got a patient, and I should really concentrate on this, and she has fibromyalgia. And she has vocal problems speaking, and that's oftentimes because of the excess phosphate. And I'll have to really make sure she understands that. She understands why her voice is changing, so to speak. So as you can see, the fibromyalgia is very, very interesting in that you have all of these additional symptoms and so many other ones, not just irritable bowel. You have other things that are involved as far as fibromyalgia is concerned, as far as intestinal is concerned. And so, but I thought I'd just throw out to you a number of things that people don't even realize maybe that they have as far as fibromyalgia is concerned that is tied directly to fibromyalgia. Now, again, you can have joint pain from osteoarthritis, rheumatoid arthritis, psoriatic arthritis, and so forth. But keep in mind that, again, number one, if you already have those conditions and they've been diagnosed by, say, X-rays, that's the easiest way to get a diagnosis from osteoarthritis and even rheumatoid arthritis if it's advanced that much. That Fibromyalgia makes them worse. And so you want to stay off of things that are inflammatory. Like I said, the low glycemic carbohydrate diet is excellent. Stay off of sugar, gluten, trans fatty acids, and dairy products. I keep on saying these to people, and sometimes it goes over their head, and sometimes they absorb them and they understand what I'm talking about. But for fibromyalgia patients that come into our clinic, we make sure that we really control their food intake as far as proper foods are concerned, and take out anything that may be inflammatory as far as their system and condition is concerned. So all those things are really, really important. Now, another thing, and I thought I'd throw this out because we're almost out of time, is because of the excess calcium and so forth, you also have an increase in water, as I mentioned, and that water, of course, causes pressure on and swelling and so forth. So where does this water go to? Well, quite often it goes into the lower extremities. The body's very, very interesting in that it doesn't fight you as far as certain things that it automatically should do. If you have a injury, where does it go to? It goes to the lowest extremity. It goes to the lowest point. Oftentimes, it doesn't stay in that one area. So if you have an injured knee or injured elbow, it goes down into the arm, the lower arm. Oftentimes, it just keeps on going down wherever the water flows to, and so that's important. But the point I was trying to make to you is that with the excess calcium, you have all of this extra water, swelling, increase in nerve sensitivity, nerve pressure, and guess what you can have from that? You can have restless leg syndrome. Isn't that interesting? So that restless leg syndrome might be related to the fibromyalgia that you're having. Now, that doesn't mean you have restless leg just because you have restless leg that you have fibromyalgia. Don't get me wrong. That's not what I'm talking about. It's just another aspect of fibromyalgia that you wouldn't even consider. And so I thought I'd throw these things out. So you can see how a lot of these other conditions that you have are really can be confused as far as for fibromyalgia is concerned. I want to keep that in mind. I want to thank some people that have been sending in messages and information. There's so many of them: Gail and Tessa and Michelle and Melissa and Paul and Carrie and Jackie and Diane and Jimmy and Brad and Mike and Leisha. There's so many that have been in communication. I can't thank you very, very much. Hey, listen, when we have these, bring your family and friends and so forth in together because I always have information that is not only fibromyalgia but also off the road, so to speak, from fibromyalgia. But it sometimes is directly related to fibromyalgia itself. All those things that I mentioned to you can be separate, okay? Everything from the sand in the eyes to the sleepless or restless legs to insomnia to diabetes and hypoglycemia and so forth. You can have those without fibromyalgia, okay? What I'm saying is that if you already have them, okay, it's going to make them worse. And the other thing is, for those people who have fibromyalgia, all of those symptoms can, you can get them confused with other things. And so that's why I thought I'd bring this out to you and make sure that you understand. Next week, very, very interesting. Nobody wants to talk about food and Thanksgiving and what you're eating and so forth. I'm going to try and make it simple for you, okay? This is the wrong time to go on a diet, but you can minimize certain things. You can minimize the aches and pains and so forth and so on that you're going to have, probably just because of non-dietary restrictions, so to speak. It would be foolish on anybody's part to say, to restrict their food intake and so forth and what you eat as far as Thanksgiving. But I can give you some hints on things next Monday that I think will help you through Thanksgiving and make it a lot easier. And that is something called balancing, okay? So that's the most important thing that you want to consider. Anyway, I want to thank everybody again for joining in. This is wonderful. I really appreciate it. Keep in mind, I save each and every one of these, so don't be afraid to go and check them. There's 41 of them now, and I really appreciate all of your comments and appreciate all the things that you suggest, and I try to get back to you as soon as I can. I hope I've answered all of your questions properly. Don't be afraid to continue the request for information. Thank you very, very much. Have a wonderful week, and look forward to seeing you again next Monday with I'll just call it the balancing act as far as food is concerned. Take care, everybody. Have a wonderful week. Bye-bye now from Dr. Ken and the Fibromyalgia Wellness Center and Stetson Chiropractic Clinic.